All right, we are live. This is United Medical ACO. My name is Kemal Erkan. I'm the chairman of United Medical ACO. This is our weekly call. Today is February 5th, Friday.
Kemal, sorry to interrupt, but I think the mic might be turned down just a little bit.
Let's unplug this so that I'll just go to the other one. So that's the red link stuff. Okay. So Valerie, it's for you.
Oh, we can't hear you now, Kemal. Not yet. Valerie, are you able to hear?
I can hear fine, yeah.
I'm unable to hear you from my end. I think he'll be on just a moment.
All right, it should be okay now, right?
Yes. Yeah, we can hear you.
So, so Valerie, we do this every week, at least 3-4 times, but every time there's some other challenge that we have. So, but it's okay. It's just a casual conversation. Again, I'm going to probably just do the intro part again so that we can maybe take the video from here. This is United Medical ACO. Today is February 5th, 2021, Friday. This is our weekly session. We do this on a regular basis, and then every once in a while, we have our guest. And today we have our Delaware House Majority Leader, Valerie Longhurst, will be with us. And she's actually, you can see her on the screen. And Tanner from our business development, who helps me with all of these presentations. And he's also participating, which makes it a lot easier for all of us. So he's also with me. So we are going to have, Valerie, this is our kind of, we do this as more like an update from the provider standpoint, so then people who are watching this can see, can maybe hear it a little bit differently, what we are going through. And then also this is, many people may not either believe us or they may not really know, but you and I, we never met. Right, so it was, maybe we saw, I don't remember seeing you somewhere else either. So it was only 10 minutes ago we just met.
That's true.
We did not discuss any of the questions. So the way that this happens, so then I give some updates, and then you also can get used to get familiar with our ACO, Accountable Care Organization. And we have some questions, and we need some help from the state side. And when I talked to Donna Gunkel, she's one of our directors, and Donna mentioned that she's friends with you, and then we reach out to you, and then thank you for accepting the invite and being here. So I'm going to go ahead and start, and I'm going to do that by sharing my screen first. And so again, for us today, we are going to be discussing the issues. With the COVID numbers, discussion with our representative, and the vaccine rollout issues that we have in Delaware. So now we mentioned our guest, and let's start with our What I do, Valerie, with these meetings, I actually take the live data from Worldometer. So they actually give this in a really nice way, so we can actually see the total numbers. And before you go into the country level, you can actually check what happened in like last 2 days ago. And then this is giving us, unfortunately, not so great numbers, but very accurate numbers. So we have 4,000 people, 4,032 people lost their lives 2 days ago. And then new cases is at 114,000 with the total case of 27,152,000. And then yesterday, these numbers did increase by 3,500 on the new deaths, and then 121,000. These are new confirmed cases, and now we are approaching to 27,300,000. And then today, and what the nice thing on this website, it does actually updates every hour. So when we check this 6 p.m. tonight, it's going to have a different number. And then with the time zone changes we have, by the time it's midnight here, we almost have final numbers, and then waiting for a couple more hours to get the final numbers from the other side. So we are at right now almost 27,300,000 confirmed cases with, this is just today, so it's not going to be as much yet there. Now, I also share the live numbers from Delaware, and although we do have the slides here, sometimes just getting it directly from the source is important. So the total number of person tested negative, current hospitalization, new positive cases, and current critical hospitalization. So when we look at these, we do educate our providers with the trend, the pattern is happening here, like these blue bars versus the orange bar here, the differences between the two, where the orange is when they are being reported versus the blue is the averages of the 10 or 14 days. So then everyone is able to kind of have a good understanding of what these numbers are. So of course, the concerning number still is the new positive cases. So although it's decreasing, we are still at around like 400 total cases. Now, when we start actually looking into these numbers, we do have one of the really the important part that we start actually doing with our network, all of our providers, we actually bring them up to date with these, and then make sure that they have their proper information. And they also didn't have to spend time from their office hours. And then by the time it's 5:30 p.m., so we have everything ready for them. And from last week of March 2020, we started having daily sessions. And then from there, it was about 3-4 months. And then we went down to twice a week now. So every Monday and Thursday night. And we added a lot of different activities. Now, why I'm telling you all these? So of course, these are important. So when we are providing our numbers, this is Delaware only. We do have clients, patients outside of Delaware, but from the network accountable care organization standpoint, from the clinical integration standpoint, Delaware is our home. So the total unique number of patients we serviced in the last 12 months, it's at 116,000. And then this is with about 430,000 appointments. Now, we believe this number from the population side, maybe 12%, but from actual active patients, we probably serve close to 20% of Delaware at any given point. And that's what we have done since last year. And it's nothing new. So we were doing this, but now we are able to look at these numbers very closely. So I'm going to have Tanner to go through a couple of our standard reports. So then we have some questions and we'll have some discussions together.
Sure. Thank you, Kemal. As Kemal was mentioning, this is some information that we have since the onset of the pandemic, been wanting to regularly update our providers throughout our network with. So that's really why we wanted to go ahead and start with those regular update meetings for our providers to keep everyone in touch, connected with what's going on with our patient population throughout the pandemic. So some of the key metrics that we keep in track of are, of course, like our own percent positive rates amongst our patient population, which we have, as you can see here, seen a slight trend downward. And alongside the rates that we're looking at, we're also keeping track of the amount of tests that are ordered through the EMR for all of our providers that are actually ordering through PowerChart. We're keeping track of that as well, which is going to be represented down here on this graph bar. So we're seeing a little bit of a decline in the orders coming out of the EMR, but we have to remember that our patients aren't or may be getting tested maybe in the pharmacy setting, other types of state-run testing centers where we might not necessarily be picking them up, but we are still making sure we're trying our best to get that documented for our patients. So we are seeing a little bit along with the state, we're seeing a drop in a positive rate here with our patients, which is encouraging. It's a good sign, of course, especially as we're still in the early onset stages of getting vaccinations. So this is something else that we like to keep track of, which is really wanting to make sure our patients are getting tests completed once they are ordered. We think that that's very important to kind of understand and get a good grasp on which patients are, or tests that might be going unfulfilled. And then part of the business development regular routine is to, alongside with our practices, kind of check up on these patients, make sure that there's no hurdles or barriers for them to get tested, make sure they are getting tested, and then making sure we have that result accurately documented within the EMR. So this red bar here is signifying the percent that are positive alongside two different other categories, which are patients that are either just not getting tested, saying they are kind of declining it, or that we can't get a hold of for a follow-up, which is concerning. So that's why we wanted to make sure we have an accurate number. And that's why the business development team, again, alongside with our practices, we're making sure we're constantly following up with these patients to make sure we have a good idea of the amount of tests that are getting filled and might not be getting filled. So here, alongside with the vaccine rollout, as we've kind of had this as a topic of discussion in events past, and it's something that we want to make sure that we're keeping on top of, and making sure that we're communicating this information to our patients as we're, again, in the early stages of the vaccine rollout here in Delaware, as well as across the nation. So this is actually a report coming out of the CDC earlier this week. We just kind of wanted to take a look at, based on the average daily first doses that we're looking at right now, where we might be going forward into the year. So how much of the population can we have vaccinated as we move into the next months, coming into the summer, and then looking forward towards the end of the year. So right now, the CDC is reporting about 8% of the population as of February 3rd, that's vaccinated. And you can kind of see that means we're at current pace of about 50% sometime here in the summer, 70%, which is getting into the area where we're considered to have a herd immunity, and then a 90% towards the end of the year. So this is some encouraging news, and this is something that we're going to keep an eye on as well and continue to present for our patients.
Tanner, thank you. So we are right now, the other thing that we want to mention, we are on the phase 1B. We completed the 1A, meaning that right now, essential employees with also person aged over 65 or older, so they're able to get their vaccine. Now, Valerie, one of the reasons for us to reach out to you was, for me, was our job, healthcare, is extremely involved with the law, this legislations, and it's not like any other business. So everything that we do, it's a very heavily regulated area. So, and personally, I have some issues that we, like as we are getting the information, it's new, we are kind of going through this and understanding there are some issues. But then when the resources are there and it's not being utilized, so then we understand the decision makers' position, like why they are really important. So then we want to make sure that we can make our voice heard by our state. And we did criticize the state a little bit heavily, maybe. So I'll be kind of like open with you. Although, you know, I supported the Democrats for the last 15 years of my life. But when the issues are there, we want to be able to share, and I mean, we want to be able to discuss these problems. So the issue, like just to give you an example, like the second dose became a big disaster because, and if you don't mind me asking, were you able to get vaccinated?
No,
Okay, so you are probably, I mean, you are just very young, so you're just waiting for your.
I'm not very young, but I
So,
think I'm in the later half, though.
so what happens is, right now with the second dose, the utilization of the second dose, it became a big problem. So many people didn't even know when they were going to get second doses, and this is still the case. My main issue is I represent private medical practices, and unfortunately, we are kind of like treated almost like the um, kind of like an afterthought. Like first the hospitals are being taken care of, and then there's the rest. But we, as you can see with our numbers, almost serving 20% of the population, I believe, in my opinion, we deserve better. So, and then we can actually help. So that's my main point. With any of the questions that we have or any of the concerns that we have, that's going to be the main, origin of the problem for us. So now let's just look at like from this one, you see this 18,000 doses arriving this week versus 70,000, that was the planned versus 18,000. And also communication is extremely poor. And this is kind of like roughly 4 to 5 million vaccines produced by both Moderna and Pfizer. So my problem more on the coordinating how these vaccines are being given. And also when we are serving, when we have completed 430,000 appointments, my medical staff is as important as the hospital medical staff. So I think there's that gap that from the understanding of what's happening. So this is kind of the Delaware level. Doses delivered 138, completed 110, remaining 27.8. Now, from my own office standpoint, what I can tell you is I did not know, like last Friday, we were told we were not going to get any vaccines this week. And then Tuesday, we got the vaccine. And then we were done. And then today, we got another shipment. So and we don't know. Like, so here's the easy, the efficient part of my. I'm just kind of giving you maybe a lot of reasoning why I'm gonna, maybe ask you some tough questions. So when we are available, and like right now, like we represent as an ACO, we represent about 60 practices just in Delaware. So like for you to reach out to 60 practice versus for you to reach out to our central office. One versus 60 different attempts, one of them is going to be obviously more efficient, but we are not even part of these discussions. So, and then the communication has to be repeated so many times. And I believe we can make this better. And when we do this better, am I asking any personal favor? No, I'm actually asking help for our business, which is going to help the society at the end of it. Because we have, one statistic that I want to give you is about 23% of our Medicare population under United Medical ACO is over 85 years old. So just imagine these patients that are going through, I don't know if you watched the old sessions that we did, but last week I was telling people I was trying to get my driver's license address change, and I didn't know DMV was doing the shots that day. They were closed. There was a huge line. And those patients, they're over 80, 85, waiting in the car for 3, 4, 5 hours. Now, if the vaccine rollouts, like I think maybe first question that we have for you is just educate us a little bit in terms of the vaccine, the role of the state government in the vaccine rollout and what we should expect. Are we expecting too much?
So let me take, I wrote down a few things that you had some questions in there. So I want to kind of backtrack and do an overview first, and then we'll move into that. So I just want to start by saying thank you for having me. I think your voice isn't heard because not that many people know of you. And I do know Donna Gunkel very well. Our daughters grew up together and spent a lot of vacations and stuff together. So I know her very well. So I'm glad she reached out to me. And I was able to learn a little bit about your company today, or the last few days when you invited me to come in and speak to you. Of course, I have to do my research. I'm a jack of all trades, master of none. So I'm going to lower the bar there right for you. But, when this pandemic hit a year ago, March, it was a complete unknown to us. And even in the General Assembly, we are usually in session from January to June. And during that time, we are only obligated by our Constitution to pass a budget, right? That's really the only thing that we are constitutionally bound to. We have to pass a budget. So we had to figure out how we did stuff virtually. And it was difficult. We had bumps in the road. We didn't perfect it. We didn't remember how, we had to figure out how we get everybody on Zoom. How do we get public comments? So we scaled back what we did in the General Assembly. And what we did is we prioritized things that needed to be done first. For example, telemedicine was high on our list. If it was COVID related, we were going to do it. We were definitely going to do the budget. Any revenue that had to come in the state, we had to deal with. So those are the only 3 issues that we dealt with, because if we dealt with all the other legislation, we would have never been able to do it. There was no possible way. We did not know how to do Zoom. We didn't have the technology. And so this pandemic has brought us along so far that we're not used to the type of business structure model that we currently had. We're living in a different alternate world that nobody ever expected us to do that. And as we go through that process, we are learning. As this pandemic hit, we are learning. We shut down in the state of Delaware, and the governor did his emergency safety measures so that people were safe in the state of Delaware. We had to rethink about how we shop, how we get our groceries. Everything changed. We had to shut down gyms, things that are important to keep Delawareans healthy. And, through the summer, we navigated. We did get our budget. We did pass some legislation, not as much as we needed to do. So then the pandemic continues on. It goes down during the summer, and then we finally get a vaccine, right? Mm-hmm. We got a vaccine. Who would have thought that we would have had it by the end of the year? So now what do we do with that? I don't think our country, and I don't think the world was even prepared for any of this. We are not perfect. We will have bumps in the road, and we are having them. And trust me, I was there that Saturday when you probably had to go to your driver's lesson. I was there volunteering. It was probably the coldest day in the entire year. I could tell you, when I got home, my hands were frozen. But all the volunteers and nurses and doctors that were out there for hours, it wasn't the perfect situation because, number one, it was cold and the elderly sitting in their cars. I had a constituent that the couple signed up. Both of them signed up the same day. He got accepted. She did not. So now he went through the line, had to wait 2 or 3 hours. We had no idea that it would be that packed. But people weren't coming at their regular scheduled times. We gave them times, but they didn't come. And then they got there and more people wanted their shots. And then we had to explain. So it was backed up for a lot of different reasons, not for the lack of effort and the volunteerism from all those people that came out that day. We are still in that learning process. And that's what we have to learn, how to be patient and how to figure out how we navigate this. I don't know that much about your organization, but as I listen and I learn, we do have weekly calls with the governor. I'm in leadership, so leadership has calls every week, and he gives us an update. We tell him what's going on the ground. We share information, and I have caucus meetings with the group in the House of Representatives. I hear their information. We take it up to the governor. So there's a chain of command of information and knowledge that's flowing. I could say DPH has weekly calls with all the legislators, and that's an opportunity for us to ask questions, air out differences. This is all new to us. It is not easy, and there's a lot of different layers to it. But when you go back and you look at the federal government, we're at the mercy of the federal government. So they can tell us one day, you're going to have 20,000. We're going to send you 20,000, right? But they don't know until Thursday or Friday. Then they're like, oh, we're only going to send you 10. So we're not able to do what we need to do, just like schedule them, get them out to Christiana Care, give them doing these sites at the Chase Center, the DMV. So it's all up in the air. So we have like 2 or 3 days to react to get these in the arms of people. So it may seem like you're not in that process, but the process is so big and there's so much going on, and we don't have the knowledge. If they said every Thursday you're going to get 20,000 vaccines, next Thursday you're going to get 20, next Thursday you're going to get 20. We don't know what the supply is going to be, and we're trying to figure that out. And I can tell you that, Christiana Care says we could take 10,000. They're only doing 5,000 shots a day. So, how we spread it out.
That's actually, I'm so sorry. That's really the problem that we have. So, and you mentioned twice Christiana Hospital, and Christiana Hospital is a hospital where they deal with much sicker patients. They deal with patients who have, they need to be in the ICU, and we appreciate that and we support them for that. But when it comes to the vaccine, preventable, like you actually did have a couple of bills that I checked, and I do see that you are really supporting healthcare overall, and that's why I'm comfortable asking or maybe making some suggestions. Primary care offices, who does the best vaccination? Pediatricians.
Yeah.
So, because a hospital nurse may not know, because last time they did the vaccine was so long ago. But my bigger problem is when we have the structure in Delaware, especially with the ACOs, there are 4 total ACOs, accountable care organizations, and 2 of them are private, and I'm one of those. And the other 2 are hospital, and the other one is another private one. So when the challenges that you are describing, and I can tell you, you are not exaggerating any of those difficulties, but I think we can help. For example, like you were volunteering at DME, right? So, well, I have at least maybe 80 to 100 medical assistants who could actually be utilized.
Yeah.
You see the resources. So then as soon as there is an emergency of some type that can be managed by primary care physicians or private practices, we always default go to the hospital, which is a lot more expensive setting. And also they don't really know. Now, my next point with this one is, because that's a really important issue, when we take certain, let's say, this is similar with the test as well, but we have a Delaware Health Information Network in Delaware, which is one of we call them DIN, one of the greatest maybe set up. Dr. Jen Lee was my guest a couple months ago. They can be utilized in some of these, communication in terms of getting the record back. So when the primary care doesn't have their patients, whether or not they are vaccinated or they are tested, so because there are random pop-up places, and when they are not communicating with the PCPs, then what happens is now we have to hunt all the information down. Tanner is one of the reasons he got to learn a lot about what we do is because we assign them to call patients to follow up, because we have so many number of tests, so many number of patient needs to be followed up. And just so that we want to put the ACO as an ACO, if it's not a clinically integrated organization, I don't think they need to be part of it, because it deserves that respect of integration. Like the central office, central business office, central clinical office. Now, under Donna's leadership, we have more than 25 care coordinators. About 10 of them are nurses. So this is almost like a hospital-like system.
Yeah.
We just do it a little bit differently. Now, one other question that I have, so let me actually bring up here. Now, we understand the politics, it's always there. Now, the communication issues that we discussed and how it's being given, like once it's received, and you are correct, the federal government does have some impact on this one. But the part of the issue that I have is like the leadership really didn't change from Dr. Fauci's standpoint. like Trump was not doing the day-to-day vaccination. So people, I mean, like you have people in your office, right? Governor Carney has people in his office, or like he has a medical director at the state. So he's not making, he's part of the decisions, but he's not actually going through those decisions day by day, right? So we want to kind of like, I just want to understand, like, um, so I mean, again, we want to make sure that this is, we don't have any other agenda other than just trying to help our community here. So the part that sometimes bothers me is that when we blame the prior administrators, then we're gonna waste time. So part of the reason, again, we reach out. So can we actually quickly engage ACOs in the decision-making process? Now, I'll give you one example. I don't know if Donna mentioned any of these to you, but the calls that we have on Wednesdays with the state, it's a dial-in, like a monologue phone. So you never know who's actually talking. There's no presentation. So, and I call them like 1967 model. So then, and I just picked that year for no other reason other than just it's in the past. So you can ask questions unless you kind of like, I tried a couple of times and it didn't go through. But in the meantime, hospitals already had their in-person meetings 5 months ago or 4 months ago or 3 months ago, and they got what they needed. They got their, the names out there, and then we still end up doing more work. So can we actually, do you think we can make a quick impact on that? So we're also trying to reach out to Governor Carney, but what do you think we can do maybe from your side?
So can I give you just a little politics 101? I don't really care what happened in the past or what's going on. I just care what we're doing forward to like get the shots in the arms. But what I could tell you is that in the General Assembly, there's 62 legislators, you've got senators and representatives, and your voice really gets funneled through them. And you have to be a part of the conversation all the time somehow. And I could say that, your business is a little unknown to a lot of people, maybe a few people know, but the way that you get your voice heard is go through people like myself and Brian Townsend to get that foot in the door to say, hey, here's another alternative to the vaccine. So when we're sitting on the table with the governor every week and with DPH, that we could say, look, here's another avenue we need to pursue. So sometimes going through your legislators is probably the best avenue if you're not getting through to the governor. That's why you have representatives and senators out in the field, because we are actually on the ground doing this and seeing it, hearing it, feeling it, touching it. And we're the ones who can elevate that conversation to the next level.
So Brian was my guest actually a couple of months ago, right before the election, he was here.
Oh, okay. Okay. And I'm sure he probably told you the same thing, maybe. I don't know.
He's a big supporter of medical practices.
Oh, absolutely. Absolutely. And somebody else that you should probably have on here is Representative David Bentz. He's the chair of the Health and the Health Committee, and he does a lot. And actually, he's redrafting the telemedicine, so to make that permanent. So you may want to have a conversation with him and have your voice heard. So when you see legislation that I do, that's when you should reach out to your representative or senator and say, hey, we need a voice at the table. Can you think about this? And, once you become a part of the conversation, it's just an automatic when things come up that we consider you in that conversation.
So this brings me to my next question, which is related to this. So if I can just share this with you, with the background of the ACOs, with the triple aim, the improve health, lower cost, better care. So as soon as we had this model, we had United Medical, this is United Medical side with the accountable care, reduce cost and improve health. So then we were actually the first local, state level, local ACO for Medicaid population, which is, as you know, it's almost 27% of the population. And then Medicare, we were one of the first ones. With Highmark. Humana is actually Humana, I can tell you, they from the Medicare Advantage standpoint, they do a great job. in terms of support and communication, and as well as others too, but I think we get the most support from them. Then this is, again, if we take the, I guess what I'm trying to say is, let's take the COVID-19 issue out for a second, because that's a pandemic and it was unexpected. But from the expected, projected, and well-planned point, we are also not at the state level in any of the committees. One of the things you see here is all the hospitals are represented. And then medical society has a ACO with St. Francis, so they're kind of like ACO, hospital type of the ACO. And all the insurance companies have their representative. And I was thinking that why not having ACOs, because between the two ACOs, and the other ACO doesn't even know that I'm talking about this, because it's not whether or not they want to do it, it's the right thing to do for our society. So for many of these issues, we could actually foresee these problems coming, and maybe because we're on the field, so we can actually quickly react to these, and from the different angles, like what happened when we had the issue in Sussex County with the COVID-19 in the chicken farms. This was an issue which it was brought up to the state's attention by one of our doctors, Dr. Joan Agora, and because she sees the patient and she has the biggest practice in Sussex County for the primary care. So, and I believe, and I'm going to ask your support for us to have it, just like any other hospitals are being represented and the insurance companies, for us to be able to represent it at each ACO should have a board member in these healthcare decision-making committees. And this is just kind of like the way that I see. Now, do you think that's something that we can achieve?
Yeah, I mean, I don't see why not. Like I mean, I can follow up to see if I can get you a seat at the table. It would have to be done legislatively, so I don't have a problem with that. You are providing some services and you probably should have a seat at the table. But the more that people get to know what you do and what you're about, you become a bigger part of the conversation. So, my suggestion, I do, actually my wheelhouse here is behavioral health. And I do think we're going to have a lot of problems with the pandemic. You've got 28 to 30% of people that are depressed right now. And I think that's the big.
With me, the percentage increases with me, but this is my way of doing my therapy. I do live sessions.
I go run 3 miles. But so that's kind of my wheelhouse. This what I would like to do is connect you to Representative David Betts. And I did have a conversation with him before I got on this phone call. And he's kind of our health care guru in our caucus. And it would probably be great to have him on one of these webinars to talk about legislation that he's working on, where you could fit into some of that conversation, how we can get you on more boards and member committees like this, the primary care reform collaboration. I'm sure that's not a problem to put you on there so you can have a conversation and have a seat at the table. Sure. But David Betts is probably your best contact.
And we'll invite him for, if it's not next week, for the following week.
And I'll forward that to Donna. And he could give you a rundown of all the bills that we're working on. And, I'm sure he'd sit down with you and talk to you about, take some input from you. But I have to say, this is like a first step for you to get engaged, is get engaged with the representatives and the senators, so that we know that you exist. You want to be a force at the table. And, this is going to help you enormously, because the majority leader, I'll dictate to our caucus members that, you need to be a process, and everybody needs to understand what you do and and that you exist in the whole scheme of healthcare. So
that's great to hear. And I have one other question, not related to, of course, related to healthcare, but not related to these items. So I know you have a couple of bills out there. Some of them are already completed. Now, the one is the House Bill 62. This is not completed yet, right? So this actually is going to be for the drug manufacturers can increase prices. So this is kind of helping to have a limit with these organizations. So now tell us about this one a little bit. Then I also want you to tell us about the bill number 13, the one that was health insurance to pass the savings to the consumers. So I think between that and this bill, between the two, I guess you are really understanding the issue of the medical costs and the increase on the medical costs, and I want to make sure that we can also help you to give you better feedback, better data from our side. So anything you would like to tell us and maybe explain the bills, that would be.
So I don't know the bills. I would have to read them because I go on a lot of bills. And so I'm probably not the person to talk to, and I don't want to like fake my way through this bill. But David would probably be the one to go through that bill with you. I go on bills to support him and the concept, but I don't know the nitty gritty of it. I've got about 30 other bills that I'm working on right now. So we do 200-300 bills in a session. So it's a lot. But I think David Benz would probably be the person that you would want to talk to about those bills in depth. And if you have questions, you can send them to me and I can get you the answers to them. But off the top of my head, unless I go through and read them.
When we have next time, so we can just go into more detail with him. That's no problem. Now, one last thing that's not healthcare. I don't know if you are following what's happening in Africa these days. My business partner, Dr. Isaias Erkan, from the Surgery Center, American Surgery Center, he's a bariatric surgeon. We started the new nonprofit charity organization called Friends of Tigray, Delaware, and we have done a couple live sessions just to bring the issue up to everyone's attention. It's pretty bad what's happening there between Ethiopia and Tigray. Not sure if, I know you are at state level, but I don't know if you are following any of those. Chris Coons, a good friend of mine, he's supporting our issue, and I think he did even talk to the new administration regarding this. But do you have any input on that, or do you know what's happening there?
Chris Coons is on the federal level and he deals with other countries. I'm really mostly like centered into Delaware. Sorry, I can't, but I can follow up with Chris.
So actually, Dr. Erkan just joined us. I don't know. Let me see if do we have a couple more minutes?
What's that?
Do we have a couple more minutes?
Sure.
Let me see. So Dr. Erkan just finished. I just saw him. Let me see if he's. Dr. Erkan, are you there? Okay, so there he is.
Hello.
Hi, Dr. Erkan.
Hi, Kemal. Hello, Valerie.
Hello.
So we are not able to see you though. I know
you're not. I'm not sure why.
Are you on the iPad?
No, I'm on my computer, the one I usually use.
If you go to your video setting, you want to make sure that you pick the, I had similar issues earlier with this session.
It's on the normal setting. I don't know why it's giving me problems now, but I can talk if you don't.
All right, so we were actually just wrapping up, Dr. Erkan, and I just, we did go through our healthcare questions, and Valerie is extremely supportive of our issues, and she has a good understanding of what's happening.
That's wonderful.
I was just telling her about the Tigray situation, and our Senator Chris Coons, the way that he's supporting our case, and I just mentioned the Friends of Tigray in Delaware, so our new nonprofit organization support the case. So, but because she's at the local level, she's not, she doesn't know much about it. So, but I think this would be a good start for us to put more communication out there. So,
absolutely. If you have a couple of seconds, Kemal, essentially, Valerie's position may be at a state level, but she is a citizen and she's a powerful citizen. And we want everybody to really be aware of what's going on in that part of the world. This is in East Africa, in Ethiopia, in the north of Ethiopia, in a region called Tigray, where for the last 3 months, there has been a devastating war that is affecting millions of civilians that have been cut off completely from getting provisions, starting from food, water, medicines. It's a catastrophic situation that will be apparent more and more as the time passes, but really with devastating results. So the more awareness there is in the world about this, the more pressure there will be for the world to do something, whether it's the United Nations, whether it's our government here, and with the new administration, we're seeing really a lot of push for things to be sped up. So that's the awareness that we want to get. I myself, I'm originally from that area, although I've lived in Delaware now for 30 years, essentially most of my adult life. I have 4 kids raised here in Delaware, or college students now. But I do have family there, and I have not been able to know, particularly in some parts of Tigray, whether those family members are alive or not. Certainly, I do not know how much struggle they are having in terms of getting basic things like food and water. And this is on top, obviously, of the coronavirus, on top of the fact that there are bombs falling on them because of the war. So we are trying to raise awareness, and if we can get somebody like yourself to at least be aware that this is happening, that you can talk to your colleagues about issues like that in some fashion, I think it's a great service. And I want to thank Kemal very much for giving me this opportunity to say something about this to you today, Valerie.
What's the population of that region that's being affected?
The population is actually 6 million people.
Wow.
Yeah, 6 million. And
a little over 100 million, Ethiopia overall.
Yeah.
So the Tigray is one of the 10 states. They have a very similar system that we have here. So they have 10 states, and Tigray is the northern part of Ethiopia. Interesting enough that when the person who's the prime minister now, when he was rewarded by a Nobel Peace Prize, it was for the peace that he had with Eritrea, which is the country right after Tigray. So now between the two countries, Tigray and between Ethiopia and Eritrea, who used to be the enemy, now they are pressing, kind of crashing Tigray. I think the problem more like how the United Nations is not really efficiently, proactively doing anything. And it's too late. Like after like 1 million people dies, whatever you do is going to be very, very late. And when we were going through, now, Dr. Gal, if you don't mind me, well, it's not if you don't mind me because it's public now, because we did it in our live sessions. Dr. Irina actually is a victim of the civil war 35 years ago. One of the reasons that he left Ethiopia is because his own father was killed, who was just a simple electrician. And that destroyed the entire family. And now when this is happening, this is actually affecting us a little bit differently because we know, Dr. Irina knows firsthand what those people are going through right now. So that's extremely sad. And we want to make sure that we can, make this, make our voice as clear as possible and as loud as possible so that we can get the attention of everyone to this region right now.
Well, Chris Coons is like a great resource for that.
Absolutely. And we're very, very happy to have him as our senator because it's interesting because he was actually the very first US lawmaker to tweet about concerns for that region immediately after the war broke out. So we were very happy to see that a Delaware senator, a small state from the United States, had a senator speaking about this issue so early. And during the confirmation hearings of the current Secretary of State Blinken, when senators were addressing various world issues, Senator Coons is the one who asked him specifically about issues in Tigray. So really, we are very proud for that. And I know, obviously, the fact that Kemal has become interested in this issue and has been pushing, also has been instrumental. So, you did not know about it. Today, you know about it. And that's essentially what we want to do, is every little bit of information and understanding will go some way to saving somebody in that region, and that's priceless.
Yes.
Well, thank you, Dr. Erkan. Valerie, thank you a lot. So I know it's busy for everyone, and you took a great amount of time with us and be our guest and answer our questions. We appreciate your support and your willingness to work with us. And let us know if we are able to help the society in any way. We are here to do that as well. So we'll be back next week with different topics, same time. And we do have some weekly set events, like one I do with Dr. Erkan on Wednesdays at 3 p.m. And then next week we have our dietitian event at 7 p.m. on Wednesday, and then we'll be back for this event on Friday. Thank you, everyone, and thank you for watching us. Bye-bye.
Thank you. Thank you. Bye-bye.